just catch up.
All right, great. Well, just to let people know, we are recording this session, so we may put it on the website and have it available for future viewing. And I want to thank everyone for attending today. I appreciate your time to learn about creating a telemedicine private practice. That's our subject for this webinar. We have a series of 3 webinars coming up here. This one is focused on sort of the basics of creating a telemedicine. We have another one in 1 month that will focus on the 7 practices that will enable your telemedicine practice, and it will go through the specifics of what's needed and decisions that you should be making and provide for the best service. And then the last one will focus on safety, medical aspects, and different attributes that you need to be thinking about when you're actually operating a telemedicine practice. So that is our piece. Just a couple introductions. Presenters today, my name's Jonathan Campy. I'm here with Brightheart Health, and I'll be co-presenting here with Lois. I'll let Lois introduce herself, but just for those who are interested in my background, I've worked in the technology field for a number of years in both public and private companies, Oracle, SumTotal Systems, and then I moved into behavioral health a few years ago and focused on around 160 facilities across the country, doing marketing, contracts, things like that. And then we created Brightheart Health, which is focused on providing telemedicine for eating disorder patients at the IOP level. And so that's my background. Lois, do you want to go through yours?
Sure. Welcome, everybody. My name is Lois Zarni. I am a licensed marriage family therapist, a board-certified professional counselor, a registered dietitian, and a distance-credentialed counselor. So I kind of got alphabet soup after my name. Started in the field as a registered dietitian 30-some years ago, and I've been a licensed marriage family therapist for about 10 years now. So I combine them, and I'm in private practice in Ventura, California. And I've been doing telemedicine for almost 8 years. Started out doing webinar wellness classes for an insurance company, and I do online teaching as well. And so John is our tech guy, and he helps us to get everything kind of lined up and problem solving if we do have any. So the two of us combined are going to help you to kind of answer some of those big questions that come up about telemedicine. Is it right for you?
Excellent. I like that DCC. I haven't seen that. So that's the distance counselor.
Right. And that's through Telehealth Certification Institute.
Interesting. So we're going to see that a lot now after people's names.
You're going to start seeing it as people are doing it because it does give you some training. You're required to take it's 15 hours, and then you have to pass the exam, of course, and then you've got the Code of Ethics through the National Board for Certified Counselors.
Oh, interesting.
Yeah.
Well, I think it would be useful. I mean, at least it's somewhat probably obvious, but maybe spend a few minutes, at least when I think about telemedicine, you think about what's happening right now. It's pretty exciting times. I mean, you go back just a few years and handsets, think about the old Blackberries, or even going before that, the Motorola phones, and, you know, people were getting cell phones, but now it's the internet, and Apple has obviously changed a lot of that, as well as Google.
Right.
And so you think about the opportunity that creates and how in the medical and behavioral health fields, telemedicine is going to revolutionize how people receive care. It's just phones are everywhere, therapists are everywhere, and people have specialties, but everywhere does not mean they're always available where you are.
That's right. Absolutely. And you know, John, it's interesting. Sigmund Freud actually used telemedicine. He used to write letters to his clients, his patients. And so it was through the old snail mail, but it still was a distance thing where they didn't always come in and see him. And in 1959, University of Nebraska used to use, and I got to read this because it's so old, a 2-way closed-circuit microwave TV system to do their research that was off campus and to reach people that were not local. And then for us here in Southern California, the traffic alone becomes a block for people to be able to get help. I'm the only therapist and dietitian in my county, and so people don't have an hour to drive each way if they get stuck in traffic. So I've been using telemedicine with clients, or they leave for college, you know, so they can't make it in because of traffic, or they've got small children, or, you know, adolescent going off to college. They don't want to start with a new therapist. So it has a lot of uses.
So maybe we could twist one of those old adages that said, if I remember it correctly, It's not your patient meeting with your therapist. It's about your therapist meeting where the patient is.
That's right.
We meet
You
our
start where
patients
they're
where
at.
they are,
And
right?
now we're doing it physically, right?
Exactly. Something like that. So, but now we've got a lot of other issues around this. I mean, to your point, it's been around for a long time, so we can talk about some of that, but also that some of the laws and regulations around telemedicine are either archaic or probably not really well defined at this point.
It's true. It has not kept up with the technology. And that's where we're seeing a lot of the states are trying to figure out what they're going to do. And the insurance companies will then eventually start following. And some of them have already started that.
All right, well, that's good. So I think this should be a good discussion, and we can run through a lot of different aspects, just so people have some background on this. If you're unfamiliar with Bright Health, just quick overview. We provide an online intensive outpatient program. Typical to any physical structure, we provide 9 hours of group therapy a week, broken up into 3 group meetings, 2 hours of individual therapy and nutrition. So it's about 2 hours. So there's a therapy and a nutrition component each week. Patients are also provided a private portal, and on that portal they have education materials, videos, as well as very specific support documents that are unique to whatever that patient's needs are. And then there's a private online community forum for them to engage with other patients as part of Brightheart. From our perspective, what we're trying to bring is a nationwide network of experts to individuals, no matter where they are. So Lois brought up the example. You have a person who lives in Ventura. They may live just outside, maybe 10, 15 miles away, or at least the story I just heard recently. You like this one, Lois? A person, so I live outside of San Francisco by about 30 miles, and it takes an hour to get in. And I was talking to an individual, and they said that it takes them an hour to go 4 miles in San Francisco to get from basically what is considered like the inner Richmond area to downtown.
Right.
You know, San Francisco is only 7 by 7, so you can just imagine how difficult it would be if you need to then all of a sudden traverse the city to get to a therapy appointment. But here's the thing that I think about when we talk about a nationwide network. It's how do I take somebody who's a specialist in a very specific area and make them available to everyone everywhere?
Exactly.
And I think that's the key when we go through the rest of this presentation. We talk about private practice. It's enabling experts and specialists to really broaden who they're seeing to people who need that help.
Absolutely.
Another aspect of Brightheart Health, just so you're aware of it, we really try to be flexible in our scheduling. We try to provide treatment opportunities or group therapy throughout the day as well as the weekend. And so we're trying to meet patients, as we said, where they're at. And we do take insurance for any of those who have questions about that. So just a quick little background on Brightheart Health. So let's dive in. So Lois, you know, what is telemedicine? I mean, you brought up microwaves. I always think
I know, really?
Yeah.
We can hardly remember it. Well, teletherapy is the old, phone. So I'm calling somebody, and sometimes we still have to use that because somebody's maybe having a panic attack, and they've only got their phone. They're not someplace else. Maybe they're on the side of the road or something. And I love the text messages, the SMS. My adolescent clients think that is therapy. We have some challenges with that, obviously, because you got to do the emoticons or something, or they're not sure exactly how to read the emotion that goes with it, because you lose that other part of being able to see somebody. And the video therapy, the asynchronous is, okay, I recorded something and you watch it later. And that's not live. You're not getting feedback. It's one way. And we use that with Brightheart Health if we want to record like an encouraging message. We know somebody's going to be having a hard time this weekend or something, that they can go to that video and watch for a minute or two or whatever it is, with maybe some tips on the skills. Don't forget to breathe and, use this skill and reach out and all of those kind of things. But that's not getting the feedback two-way. We obviously have the online websites, community forums. Everybody's got the smartphone apps. We've got it for being mindful. We've got it for tracking our exercise and everything else. And now they also have, obviously, the mental health ones. I found one that was for DBT skills that you can do with your smartphone. But that's not really coming both ways. That's more of the self-help. And then we have video conferencing like we're doing right now, where it's interactive. You and I can have that conversation and we can see the expression, we can get the body language, you get a better feel for it. And that's where insurance companies are starting to look at, okay, that is as good as seeing somebody in person. And in fact, There was a research study that did cognitive behavioral, and it was done just a few years ago. And they did cog behavioral in person, and then they did it with telemedicine, with video conferencing. And they actually found that the video conferencing people did better.
That's amazing.
Isn't it?
But you're right. I mean, it's a very intimate setting. I mean, you and I can
Right.
see each other. We can talk to each
Right.
other. You can see
Mm-hmm.
facial gestures and physicality and everything.
Mm-hmm. And the client's more comfortable because they're in their own environment. They're not coming into an office where they're not as comfortable. So they could be coming in on video conferencing from their bedroom or their living room, wherever they're comfortable.
Interesting. So that then speeds your ability to have an effect.
It does, because they're more comfortable. They often open up faster.
All
They're
right.
in their own environment and they feel safer there.
Okay, I have one crazy question. Is the APA going to provide guidelines on emoticons?
I'm not sure, but we've got clients who are asking for emoticons from Bright Heart Health. They're like, we want our own. So tell John to get on that.
All right. Well, I mean, you can obviously imagine there are some people who are going to be supporting telemedicine and they're going to be right on it. They're going to think this is the way of the future. And I think anyone who probably doesn't think this is the way of the future, they just need to ask themselves a couple questions. One, does everyone have a phone? Two, are people, at least perception-wise, being more busy than they were in the past? I mean, I know my mom, 75 years old. Every time I talk to her, she says how busy she is. She doesn't work. She doesn't do anything as far as I know, but she feels like she is absolutely overwhelmed busy.
Right.
And so,
and there are research studies that say we are working longer hours and we're traveling farther to get to work.
So
our work days that cut out is actually there. Yeah.
And then you're going to have the people who are going to say, whoa, 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 no way. Telemedicine is for the birds. You can't actually be as effective as in person. I'm never moving in that direction.
Mm-hmm.
And so it's going to be interesting to see how that plays out with people's mindsets, because I think it is I don't know if it's an age thing or what, but you're right. I mean, people who grew up today, they've grown up with where the internet was always in existence, the young adults now. That's just surprising.
Yeah, we've got a question that someone said they're having some distortion of the voices. Might be they're not having a really good internet connection because it can start to kind of warble.
Yeah, and it could be too, if they called in, that might be the same too. I don't think we're seeing that. If others have that problem, just please go ahead and post it up under the questions. I should point out at the top of your screen, maybe to the left, you're going to see a question and answer section. Feel free to submit questions throughout this presentation. We'll get to them at the end. This webinar we did schedule to only be an hour, so we will be respectful of your time and end at that time. So we'll take as many questions as we can before we get there. And let's see, one thing that I thought would be useful, Lois, is just to take a quick poll and find out how many people are actually using telemedicine today.
That sounds good.
Go ahead and stop sharing and submit my poll so people can ask it, or answer it, I should say. And if you can on your screen.
Another attendee said they're hearing fine, so it's probably an internet connection.
Okay.
It can get warbly.
Excellent. And I think it's interesting that, you know, as we put this poll out there and people are going to specify if they're using it or not, you know, it's about 50-50 right now. It's actually probably more 60-40 are using it. So I'll go ahead and end the poll. We don't need to spend too much time. I'm sure everyone knows how to click yes or no. The way that people are using telemedicine, I think, is quite interesting in that we're solving a need, but we may not have actually thought through all the aspects of, oops, let me stop that again. Reshare that screen, please. Thank you. And rethought all the aspects. So let's start digging into it. So Lois, take us through. What are the advantages, pluses, minuses? How should they be thinking about this equation?
Okay. Whenever you're looking at, is telemedicine going to work for me? We have to look at, first off, do I have the internet connection that I'm going to need? Do I have the equipment? And do I have a tech guy who's going to help, or a lady? So then you want to look at, is it going to be a good service for my clients? And I have some clients who, for example, have panic attacks. They can't drive. I have one that can only drive about 3 miles. So it's a great fit for them. So will they accept that medium? Are they okay with the video? And I find that even clients The middle-aged to older ones are hesitant with it. But the younger ones are like, yeah, no problem. They'll just sign right on. It's not a big deal because they've grown up with it.
Yeah.
So are they going to be able to adjust to it? And I've had a couple of middle-aged clients where something happened, like they didn't have childcare or their child was sick, but they didn't want to cancel the appointment. So they're able to call in from home, and then they don't have to worry about a babysitter. They're still there if their child needs them. They're still in the house, and they've got the child, with the movie going or whatever that is. So it can work really well, and they can get the expert. Like I said, I'm the only one that's both an MFT and an RD in our county. And so they don't want to drive the hour to get here. Then they're, paying for a babysitter or childcare for 3 hours, or they're stuck in traffic and you leave work and you don't get here till 6. And so sometimes it is going to give them the ability to get to the person that's the specialist that they need. My other specialty is addictions. And so if I've got a dual diagnosis client, this is going to be a great way for them because they may not find the services otherwise.
Right.
And it does give us, as practitioners, another added bonus for our clients. When they're looking at, do I go see this therapist or another one? I have the ability for them to schedule their appointments online. They can change their appointments through a secure HIPAA privacy protected server. They can do the video if they want to. So it gives them more options that will fit with their schedule changing, especially when I got parents with adolescents. They're coming, they're going, practice and all of that. So you have to look at first, is it going to fit for the type of practice and the type of clients that you want to work with? Now, the disadvantages, and I hesitated even calling it disadvantages, I think it's more about things that you need to consider and make a plan for how you're going to take care of them. As soon as you're going to do telemedicine, you are definitely under HIPAA. So if you've been avoiding being HIPAA compliant and you're just, I'm not going to do that electronic billing, I'm not going to do anything except snail mail, then you got to bite the bullet and you got to be HIPAA compliant. That's just the way it is. There are certain licensure restrictions. I had a lady email me. She saw my website, and her mom, this is another great use for telemedicine. Her mom is in Arizona, and she's in Seattle, Washington. And they're having really tough problems with their relationship, and they wanted a mediator in the middle, a therapist. So you can sign on with them from 2 different locations. I had a family from Central California, and their adult children were down here, and they wanted to be able to get together as a family, but neither one wanted to travel 3 hours to get there. And so that can really help. But the licensure right now, for me as an MFT in California, my client has to be in California.
Right.
So that's where we've got to look at, and that's changing, but right now that's where we are. Technological challenges, you got to make sure you got good internet. That's we pay for the faster internet here at my office to make sure that I've got a good system. It's reliable. I rarely have ever had internet go down, but you got to be ready for that, and you've got to have your computer. One time, my computer crashed. I had to have a backup plan, so I had my tablet, and you can still do this with a tablet. You can do it with your phone. So have your backup plans, have it loaded and ready to go. And sometimes this is the challenging one. Making that risk assessment can be a little harder. So you've got to really make sure you've got your questionnaires lined up, that you've got data. The client is going to answer those questions. Telemedicine is not going to be a good idea if your client potentially has a risk for or is currently suicidal, homicidal, or they have psychosis. If they're not in touch with reality, this is not a good way to do this. If they've got a lot of risk factors for suicidality, not going to be a good match. They need to have somebody physically there for those type of clients. So those are the ones that I then say, well, I can't offer that service, but I could say, let's find you somebody local if they're out of the area, or maybe they know they just have to come into the office. The other challenge is you really can't give that touch if somebody needs that, just touch on their hand, the little pat on the shoulder. But we do a virtual high five. We can do that. We can do a fist touch, we can do that. But we have to be ready for that physical presence isn't going to be as powerful. Although you will notice that if I lean back, there's a different feel than if I come forward and I'm looking right at the client. And you can You can still adjust that. And I see it too. We had one of our clients, Bright Health, who was back farther from the screen as usual, and she wasn't looking at it. She was looking around, and I'm like, so what's going on? And I leaned forward to draw her in. And so then she said, I'm really having a hard time right now. Okay. And we have the group, and they were all like, well, jump right in. Well, okay, we're here to support you. What can we do? And so I don't see them necessarily as disadvantages as much as they are the challenges that we have to prepare for. And then we put down there the safety and the quality, because that's the number one question we hear from people is, well, is it safe? It's as safe if you're doing your assessments as if you saw the person in person. And there are certain things we're going to cover in another slide that we have to line up to be ready for in case something happens. And the quality, as you can tell from the video, you can have just as good quality. You can get effect by leaning in, by looking more at the camera. You can get effect by moving back, and you can bring your hands in the screen. And you can actually pick up your computer and move it and have a whiteboard behind you, or you can have it on your screen and you can share it. I know one therapist was telling me, well, I do a lot on a whiteboard, so that won't work. Well, no, actually it will. You put your computer onto a rolling cart. You've got your whiteboard right there. You just turn the screen so the camera is on that whiteboard, and you write on it. So it still works. You just have to look at it a little differently. You can also get software on your screen that you can do a whiteboard right on your screen. We have handouts we upload. We have forms they can fill out, and they can send them back. We can share. So the quality, I think, is just as good, and the research is showing that the benefits and the outcomes are just as good as in person.
That's really interesting. I mean, it's good. And I think you're right. Based on our experience, there's a lot of fear because it's new.
Right.
But once you start to uncover that or start to analyze some of the issues, you realize that it's actually not that far from what you're doing today.
Yeah, and you've got to just kind of think it through, because if I use a whiteboard a lot, but I don't have my computer with the camera on a cart, then I'm going to be like, well, the whiteboard's over there. So I've got to prepare for that. I've got to know that that's how I like to work, or I'm going to get the software and learn how to use it on my computer. So it's more about thinking it through and seeing, how is this going to work? And sometimes it's just really going with the client and saying, I've never tried to do that. Let's see if we can do it. And just being that curious, non-judgmental, wise mind, and say, what can we do here?
Yeah, well, that's great. Well, let's talk a little bit about the technology, because you brought that up, and I think the technology choices are difficult for people to assess. I think most people rely on Skype or FaceTime because they're readily available. Most computers have Skype preloaded onto them. FaceTime is on every Apple device, and that seems to be between that or Google's Hangouts, I think, is the other option. I mean, everyone has these video conferencing tools that are right there, and most of these are set up for one-to-one. So Skype is a one-to-one, FaceTime's a one-to-one, and so for Brightheart it doesn't work. But I think the piece that was interesting to me in looking across all these is which ones are HIPAA compliant. And you may think, oh, well, do we really need to be HIPAA compliant, and what's the risk there and all that? I think it's important at least that you know what you're dealing with, and if you're being true to the regulations, then yes, you need to. And knowing that just because you have Skype, that's not HIPAA compliant. They actually are not HIPAA compliant. And so it's important that people know that. You'll quickly know if someone's HIPAA compliant because you have to sign a business associates agreement, which basically defines their HIPAA compliance and how they're going to work with you. So, well, I'll get into the business associates agreement in a second, but here's just a few vendors. There's many more out there. The field is littered and going to be seeing even more providers come into the market just because it is a hot space. I should point out that telemedicine right now is the fastest growing space in healthcare, and it's scheduled to grow by 20% every year until 2021 right now. So it's going to be an explosive area. And I don't think there's probably a hospital or big provider out there who is not exploring, engaging in, or doing some sort of telemedicine. But when you look at this, there's I put the first two, Skype and Apple, which I already spoke about because they're so ubiquitous. But then when you look at like BlueJeans, GoToMeeting, WebEx, these are your traditional corporate solutions. And I bring them because you're going to see ads for them. Or I put them on here because you're going to see ads. They're big enough that they're going to have advertising budgets. Now, what's interesting is all of these are going to be HIPAA compliant. And so you start to move to the right and say, okay, well, now let's talk about ease of use. And the products that have been on the market the longest you would think were the easiest to use, but it's actually the opposite. The technology has moved so fast that the solutions that were developed, say, 5-10 years ago, have now become more difficult to use because the browsers have upgraded so much and the way that the phone has upgraded so much. So the products that seem to be easier to use are the ones that have been created more recently. And so that's why I wanted to put that out there. I wouldn't say any of them are difficult to use because they wouldn't be in business, but it's important that you understand you don't want to be in the tech support world. You don't want to be trying to resolve why your patient can't get into a session.
That's right.
You want to know, okay, well, these are the ones that are going to be the most trouble-free.
Mm-hmm.
And then the last is cost. Skype and FaceTime are free, but I always wonder, like, sometimes the free is not the best solution, or maybe a little bit too personal if you're using FaceTime for other things. You don't want to be getting a FaceTime call always. But the others, cost-wise, you can see are a lot higher. The product that we use, just so you're aware, is Zoom. There's another product that's very specific to telemedicine video conferencing, which is VC. What I found was that Zoom was the easiest to use for the price point. And so that's why we liked the Zoom product. Whereas VC, again, very easy to use, but a little more expensive. And so research these costs move around. I don't want to say one is better than the other. I just wanted to let you know which one we use. And these vendors are in business to get your business. So these price points probably will move around for you if you're going to negotiate with them.
Mm-hmm. And I think that's critical that you find something that fits for you.
Absolutely. And let's talk a little bit about the Business Associates Agreement. So Business Associates Agreement was created by the vendors to outline their HIPAA compliance to the purchaser of the solution. And everything's moving to the cloud. If you're not familiar with these terms, the cloud, basically, they manage the software. We don't have to manage it. And what you want to know in these Business Associates Agreement is exactly what are they providing. They'll provide HIPAA compliance, but there's some very specific things that you want to understand. One is around security. They have the obligation to provide a secure platform, meaning that people can't hack in. And if they do, what's their notification process? Because if for any reason you do have a session and it is hacked or their information on their system is hacked, we've seen a lot in the healthcare industry recently of people of organizations' databases getting hacked and that information stolen. You need to know what that vendor is going to provide for you and what security is there, and then also what are they going to do when that happens. The other one is around the personal health information and how are they going to manage that and who has access to that and what's the length that they're going to store that, and is it going to be stored in an encrypted format. So there's a lot of information that you just want to look at, and I don't know that you're going to need to hire an attorney and go through it in detail. I think what you're looking for more is, do they seem to have this pretty straight away in terms of what they're doing?
Right.
What's your thoughts, Lois?
I think that's really critical. And even like the practice management software that I use has the electronic medical billing. It doesn't have secure chat. There's another company that does, but then they don't have the electronic medical billing. So you got to kind of pick, are you going to be doing chat? Are you going to be doing blogging? Are you going to be doing something where you need it? I know an awful lot of counselors and therapists out there that are not using HIPAA compliant emails. They're not using the HIPAA compliant, with the text messaging on your phone, where somebody could get access to that. And you either have to disclose that to your clients, just like these, business associate agreements. You have to disclose to your clients where there may be risk for that security. But if they don't have a business associate agreement ready, then that's not a company that's used to doing HIPAA.
Yeah, I would agree with
go
that.
there.
Yeah, I think for everyone's benefit, the last thing we need is somebody to have a very public event in telemedicine.
Right.
That's an adverse event, and then we find out, well, it wasn't HIPAA compliant, and it wasn't this, and we broke the licensure laws and all that. But before we move on, let me stop here again and do one more poll, just because I'd like to know where the group's at so we can tailor our talk track to them. I'm going to go ahead and launch this poll, which just asks, what's your biggest concern with telemedicine? And we started to talk about the technology, and now we'll start to move into the other aspects. But I'd love to just get some input here real quick on what people think is their biggest concern or most challenging aspect that they feel they're going to have to deal with.
And we're guessing that everybody that's on this webinar is either in that pre-contemplation stage, they're contemplating, or they're in preparation. They know that telemedicine is there, and they're looking at, maybe, or they're actually preparing for it. So we're trying to figure out, what is the thing that holds most people back?
Yeah, I would agree with you. I mean, if telemedicine is the future for therapists, then therapists using telemedicine are the future. I mean, that's the easiest way. Okay, so I think we got kind of a split here between HIPAA regulations and licensure regulations. So we'll go ahead and end this poll real quick and jump right back into it. We can talk a little bit more about the HIPAA and the licensure. So let me go back to the presentation. All right, well, let's talk about licensure. So the licensure laws are archaic. They are changing fast. Well, I shouldn't say they're changing fast. The discussion is pretty strong right now around how do we deal with telemedicine, because the laws were not written when telemedicine was an option, so they're not really clear on how they're going to deal with specific items. Now, I know that the laws say, you have to treat someone in the state, and what happens when they travel out, and let's say they're only traveling out for 30 days, then you can continue to see them and all that. But you really actually have some bigger issues. You have therapist shortages in certain parts of the country. You have specialty shortages. You have a mobile population now. And you also have a traveling workforce. So there's lots of things that are sort of pushing on these laws and on the medical side. So let's just take what I think telemedicine provides as an opportunity right now, and then let's talk about what's happening in the licensure laws or that represent potential change on the horizon. So the first thing is, today, if you just look at sort of the top bullet, patients who live within a 30-mile radius. I chose 30 miles in particular for your practice. It might be broader, it might be 50 miles, it might be less, it might be 10 miles. The idea is that you have a catchment area, the area that most of your patients come from, because that is what is drivable, that is what is convenient. And so you could probably, if I asked any of you, you'd put a number on there, and I would bet it would be between 0 and 50. The next interesting one is the one that you brought up, Lois, which is, let's say I have someone in Central California and another person down in Southern California, or I have a patient that is moving to Southern California from Central California. I chose Monterey here in my little diagram. But let's say now they're going down to Santa Barbara for college, and I've been working with them for 2 months, and I've really established a great relationship with them. What does it mean now that they're moving away? Well, if we don't have telemedicine, it means they have to go find a new therapist, which may not be in their best interest.
And especially if they're at college, then they're coming home on summer break, and then their therapist is now at college. They haven't kept that continuity with the therapist in their local area when they come back.
Yeah, and what happens if now it's the summer and they're going to go do an internship in Texas for 1 month, and then they're coming back, or 2 months, and then they're coming back. So we're going to destroy this relationship. We're going to try to provide care continuity, which is going to be almost impossible based on their schedule. So
or one of our clients that went to a family event in New York City, she's here in California, and it was stressful because of the family dynamics, and she has no support then if I can't do telemedicine with her. So we set it up that we could.
That's right. And that's exactly it. So that's the way that we look at this. That's the sort of low-hanging fruit, or the next most obvious area that telemedicine is going to help enable private practice. The third is a little more interesting, which is if you have a specialty, and whatever that specialty might be. So in Lois's case, it's for her whole county. She's the only MFT/RD. Now all of a sudden your catchment area changes because this restriction from geography is removed. So the idea that that person doesn't want to travel an hour and a half to come see you because they're 50 miles away or 80 miles away, whatever it may be, you can actually reach out to them. There's no travel time. That 1 hour is just 1 hour of therapy.
Right.
So the convenience factor alone is going to push telemedicine adoption significantly.
Yep. Absolutely.
So I think this is the short-term opportunity, and I specifically chose one state. People may have licensure in multiple states, but I chose one because this probably affects the most amount of people, and this is the near-term opportunity. Let's talk a little bit about the long-term opportunity and what's happening. So this is on the medical side, not on the therapy side. And so what's happening on the medical side is there is an Interstate Medical Licensure Compact. And it has been adopted now by, I believe, 9 states, and those are represented in blue. And basically, these states are now saying, you know what, if you have a license in one of these states, you can operate, or you can practice in any of these blue states. So the idea is that your licensure is now portable. And there's forms that they have to fill out and all of that. The orange states are states that are now considering this same, whatever you call, compact as their licensure reciprocation. And I don't want to use the words reciprocation because if anyone has experienced state reciprocation, it's really convoluted in which state you talk to and what's allowed and what's not. This is really not reciprocation. This is basically saying, we recognize your licensure from this state as being equivalent of our state, and therefore you can practice in our state. And as this becomes more widely adopted, we believe that this is then going to push into the mental health and into the licensure laws that affect all of us. I mean, registered dietitians, right, are nationwide already.
Yes, but some states do have licensure on top of the RD. California doesn't, but some do. So RD needs to know whether that state requires licensure or not.
Yeah, so I don't know how long it will take for this to be adopted. This has moved very quickly, just this compact alone. I think 3 states just signed on in the last 2 to 3 weeks. So it is moving quickly. And I think as that happens, all healthcare will start to follow suit and look at that, because it just makes sense based on how.
And we're getting more and more data from the research that says that it is just as good as in person and sometimes even better.
Yeah, I see. And that's the important part.
Right.
All right, well, let's go into some of the safety stuff, and this will touch on a lot of the HIPAA aspects that people had concerns on in the poll.
Okay, so the critical part with telemedicine is you've got to include it in your informed consent. You have to tell the clients what the benefits are, what the risks are, same as you do with in-person counseling. So I have an additional telemedicine form. CAMFT, California Association of Marriage Family Therapists, has a template that you can use. But there's some things you might want to kind of beef up on it, depending on what you're going to personally provide. So you've got to tell them about telemedicine, what services are available, how they would access that, and how you're going to bill for it if you're going to do emails or text messages or instant chat. All of that has to be included in a way that the client will understand, so that they're not texting back and forth with you for half an hour and then you bill them and they're like, I didn't know I had to pay for that. So again, it's that typical informed consent we have to tell them ahead of time. And we've got to know how we're going to handle it if there is a technology problem. If you lose, internet, or I do, we lose that connection, we drop the video somehow, this is what we're going to do. We're both going to try and sign on for the next 5 minutes. If we cannot get signed on in that next 5 minutes to the video, we're going to switch to phone only. And then we're going to either reschedule, make arrangements, or whatever it is. Same as if a client had a car accident on their way to your office. You've got to have your backup plan. You let me know right away. But knowing ahead of time, okay, if suddenly something goes blank on my screen, we're going to try, both of us are going to keep trying for 5 minutes. If that doesn't work, then we're going to go to here. That lets them know, okay, we've got a backup plan. This is what we're going to do. They have to have privacy. They cannot have kids around, people walking around. I was leading a group and I saw somebody walk behind the client, and I immediately shut the video and audio off. And I just let her know, when you have privacy again, let me know and I'll open your video again. We can't have somebody walk in and see everybody else that's in the group or what's going on or hearing it. We use the earbuds, so they're not going to hear everything, but they would hear you talking. And so they have to be in a situation where they can have some privacy. And they've got to be ready for, if something does happen, somebody comes in, this is what we're going to do. One of the other clients, her husband came walking in, he forgot she was in session. And I just clicked it right off. And then as soon as she was available, she just sent me a text that said, okay, it's clear, and we came back on. So we just have to know how we're going to handle that. Same as if somebody walked into your treatment room, like the UPS guy or something. I've had that. So seriously, sometimes you go, there's a sign there that says do not disturb in session. What part of that did you not understand? Yeah. We have to train everybody, right? And we have to, and this is critical, we have to identify the client. Now, in California, we have the red flags rule. It came out about 5 years ago. And it's to help to prevent identity theft for medical care. So the first time I'm meeting with a client, I need to see a photo ID that says you are who you say you are. Well, if it's on the screen and we're doing video, then I still have to see that ID. Because otherwise, John, you could be impersonating somebody else. I'm going to bill your insurance, and then you're going to get that bill in 30 days, and you're going to be like, I'm not seeing this person. So I have them show the ID up to the screen, and I just take a screen capture of it. We're good. I see the picture, and then we set up a password, because if they're not going to do the video, I can't see that they're really who they say they are. And what happens if, the roommate or the boyfriend or the husband doesn't know they're in counseling and they impersonate them? They email us or something. So we set up a password that says, if you don't give me that password, I'm not responding, because I don't know that it's you. And again, that protects the privacy. If we have the video, it's a lot easier because you can see them. Like, oh yeah, that's John. We know who you are. And we're good. But if you can't for some reason, you got to set those things up ahead of time. Always have the business associate agreement. If I'm looking at working with any company, whether it's for the video service or it's for the electronic medical billing, anything, if they don't have a BAA, they don't understand HIPAA. I need to know that they've got that security set up, because then that protects me, and how they're going to handle it if there's a breach, because then it's not under my liability because I went with some company that doesn't have any kind of system set up. And they've got to have the HIPAA compliant technology services. If you're using your computer, if you're using your phone, you need to make sure that, like, texting just regular on your phone is open access to just about anybody. And there are some certain software programs you can download for your phone, your tablet, or your computer that are HIPAA compliant, that will secure it and encrypt it and de-encrypt on the other end. And we've talked about that red flags rule. It really comes to that identity of the client. If you're not doing the red flags rule, it also has in there, if you're accepting credit cards, how you would flag their account if there's fraudulent use on their credit card. And I just simply say, I don't accept credit cards. So there it is. But you've got to get this set up ahead of time if you're going to do telemedicine.
That's good. Good details.
Now, this is a critical one, John. Because they're not in my office.
Oh, yes.
I need to have, I won't start telemedicine without a release of information that authorizes me to exchange information, not just one way, with a support person that they have identified that is local. It can't be their parent that's in another state. It has to be somebody that lives nearby or is nearby. Because if they do get suicidal, homicide, or something unexpected is going on, I have to have that emergency contact person, because I'm not there to be able to handle it myself. I have to have that release ahead of time. Every time that they sign on, I ask them, where are you located? If they say they're home and I've got the home address, that's great. But occasionally, like one of the clients got out of work late, so she drove to some place and was in her car. Okay, I need to know where you're at. Because if there's an emergency, I can't send them to your home. I need to know the local police number, because I can't call 911. It would take forever to figure out from 911 local to where they are. Emergency service numbers for local services. It's good to know what kind of response time they have too. Are we talking 20 minutes? Am I going to need to get that contact person there first? I have to know that they're not driving. If she's parked someplace, like outside of a Starbucks, so she gets the Wi-Fi, okay, but she can't be driving, or he. Because if they're operating equipment, they're distracted, and then we're distracting them more. It's not a good situation. It's the same as having somebody in client, and they're in session, they're trying to do something else at the same time. And you have to have a second mode of contact. If I'm talking to you, John, and you're starting to decompensate, and I'm like, okay, we need to call your support person in, I don't want to hang up with you to call them. So I've got to have a second phone line or way to contact that support person that keeps you in the session, so I can keep monitoring you while I've got the support person on the other line and getting them on their way to you. And what is their time delay? How long is it going to be? And then I want to know they got there. So they get there, they look into the video. I'm here. Okay, we got it. And then I want to follow them like I would with any client, that they've gotten to the safe place.
Yeah, all good advice.
So
very good details, things that you have to
be thinking about. Yeah, it only takes a couple seconds when a client signs on. I first say, is your support person available? Yes. Where are you located? Home. Okay. And the third one is, do you have privacy?
Yeah.
If they say yes to all three, we're good to go.
Easy.
Yep.
And I just saved you 20 minutes to an hour commute.
Yes, exactly.
All right. Well, here are some additional resources if you're interested in researching this more. The American Telemedicine Association is probably the leader in providing telemedicine information. I think they also have some samples of informed consent, telemedicine informed consent, as well as what's happening with licensure laws, reimbursement, things like that. Practice Central, in addition, has a lot of information around telemedicine, Zur Institute, and then the Telemental Health Institute has a lot of information. Now, we're going to be going through in more detail a lot of this, and I'll go ahead and click to the next webinar. I'm actually going to be doing it with Jackie Holmes, and this is where we're going to go through the considerations for a telemedicine private practice, and these are really sort of the big decisions that you're going to want to make and how you're going to approach them and what are the trade-offs when you approach them. We'll be doing that on July 16th, again, 10 a.m., and it will be 1 hour in length, just like this one. And so that's the next upcoming webinar. We do have a third one in August. That one will be with Dr. Vicki Burkus, and that one will be covering off more on the medical side, safety issues, things like that. So taking what Lois just brought up, and what are the protocols and practices that you need to put in place for that. So we'll be going through in more detail, and we are certainly open to feedback. If there's particular items that you want us to present on, we would be happy to. At this point, we've concluded the slides, but let's go into some of the questions and answers. So I think you also have access as well, Lois, so we can just kind of go down through.
This is a good question. If someone does have suicidal ideation but has a local psychiatrist and local crisis numbers, do you still consider telemedicine? I don't. Some people do. And like I talked to the CAMFT attorney and he put it this way: how close to the fire do you want to be, Lois? And I like being back further. So I don't, but some people do. And it really comes down to your comfort zone and how you're going to handle that situation. And, you know, we all have that situation where you've developed a relationship with the client and then some crisis happens in their life and they develop suicidal ideation. They didn't have it before. Okay, that kind of situation I'm going to need to handle. But if I know ahead of time that that's a potential or it has been, I'm not going to go there. Stephanie asked about, she uses VC for free. Do you know about what the fees might be? That the free version, I understand, was not HIPAA compliant.
It's a great question. I don't know. And that's why I don't want to guide people too much. That's why I said, you know, on the free and the pricing and all that, that stuff moves around on a daily basis.
Right. Does the client get charged for the program use? No. I pay for that service and that's included in my cost.
Let me give real quick a piece of advice on all the software. So if you're going to be purchasing the software and you're actually talking to someone, again, you're not really purchasing software because everyone I presented was a cloud provider. And I will tell you that with HIPAA, go with a cloud provider. Let them deal with the HIPAA stuff. You don't want to be doing that. You're not in the technology business.
Exactly.
If you want to get the best price and you're actually talking to someone, and if there's anyone in technology on the phone, they're probably going to find where I live and come after me, is make sure you negotiate that contract on the last day of their quarter. So find out whatever their business quarter is, ask them directly, look in any public information. But I will promise you, you will get the best deal if you ask on March 31st, and that's the end of their quarter.
Nice.
Yes,
I'll remember that.
Always a great way of getting a good discount. I did flip it back for the resources, and we will be making these slides and recording available on our website, so you will be able to have access to this in the future.
Right. And the forms for the templates, I think you might be covering that next time with Jackie when it's in more detail.
That's right. All right.
And the links are still on my screen.
Yes, I put them back up. I flipped back over for that.
Which insurance companies are already covering telehealth services? John, don't we have parity in California for that?
We do have parity. So there are now 27 states that have insurance parity that basically states that telemedicine must be reimbursed at the same rate as an in-person session. They cannot...
Right. And if you're doing the billing to the insurance company, it's a GT modifier that you put on the CPT code. So if you're doing like an individual session 90837, then you put a -GT, and that says that it's synchronous live video, interactive, and that's supposed to give you that coverage. If you do a GQ, then you've recorded a video and the client's going to watch it later. They don't pay for that.
Yeah, very good. Very good. And we do use, so the question came in, do you use Zoom or another service that has mobile access? We use Zoom. They do all forms of technology, so phone, tablet, and computer. The only point that, the only thing I would point out is they do not at this point support the Chromebook. And if you're working a lot with students, I've noticed, at least in my experience, a lot of students have Chromebooks. So it's a different operating system, so that's a challenging one. And it looks like we just got another question for you, Lois, on the HIPAA compliant with email and texting.
That gets a little tricky. According to what I've been told about HIPAA, if you do anything electronically other than the traditional old fax machine that's through the phone line, then you are a HIPAA entity. So you can do snail mail, you can do fax through a typical phone line. Anything else, you are.
Yeah, I think that's good. And you can sign up for email that is HIPAA compliant pretty easily. It's not as, I would say, it seemed like, a few years ago, it was pulling teeth trying to find somebody, and they had these astronomical fees they wanted to charge you. Now it seems to be pretty reasonable. But
you do need to make sure they're HIPAA compliant. Gmail is not. Your typical email system is not HIPAA compliant.
Yes,
I have HIPAA compliant email through my practice management software. So they have to sign in, and it's a secure server.
I think the easiest way to know if you're HIPAA compliant is whether or not you sign that business associates agreement.
Right.
So, yeah, and that was Chromebook. It's Zoom who, at this point, does not support the Chromebook, just so you guys know. Question that came in on that. Questions on which states are covering reimbursement. I would recommend you go to the American Telemedicine. It changes very frequently. They have great reports there that show which states, how it's being done, who's supporting it. Is it Medicare? Is it Medicaid? Do you have to use video conferencing? So I will point out that almost all of these require video conferencing for reimbursement. They do not cover email, text, phone, teletherapy.
Nope. If you can't see them and interact with them, they won't cover it, basically. And sometimes you have to be the advocate for it, because the insurance companies are going to try and do the same thing they've done, like with parity with eating disorders. It's like, no. It's like, yeah, here's the law, and you need to do it. They just don't want to update if they don't have to.
Right. A couple more there, Lois, at the bottom that just came in. I'll let you grab those. I'm going to start marking these that we've answered them.
If you have a statement on your email form that states the client is okay with using non-secure email or text and the client signs, can we use it? You can. You're a little closer to the fire, according to the attorneys, because it's not HIPAA compliant, and you have to be really clear showing them that the potential risk is somebody could get into that email and it's going to become public knowledge. It could be posted on social media for all we know. We hear about where somebody put their email and didn't go through a secure server, and it becomes, social media, Facebook, and it's a huge thing. So I personally don't just do that. I tell them if they choose to do it, and I've given them full warnings. I can't help it if they decide to text me or they decide to email, but I do really strongly emphasize, don't put anything personal in there. Don't put anything you wouldn't want on social media.
I think you got to repeat that about 100 times to these young kids.
On a regular basis, yes.
All right. Any other questions coming in? I think we've answered any of them. If we did not answer your question, please go ahead and post it now. We'll make sure that we answer it here while we still have the session live. And then if there are any reason questions pop up in your head, or like I said, you want to see different content or more explanation around specific content, please email us. We'd be happy to add that into future webinars or just respond directly back to you and give you the information. That's the purpose of this, was to share this information. We're dealing with it on a daily basis. We've become experts in it, and we're not necessarily experts for you. We can provide advice to you on what we've learned, but it is worthwhile for you to investigate on your own and listen to, at least from our experiences, and learn from them. HIPAA compliant email programs. I'll cover off on a couple of those. So there's you would need to look them up. There's a number of them. If you just type into Google HIPAA compliant email, you will get a number of services that are available. I think Preferred Trust is one that I've seen. Gmail, if you do a paid for Gmail, they have a version.
Right.
It's not the one you use on that you're using with all your friends and
exactly.
maybe even using for your practice, but they do have a version if you sign up for it and you do pay. It's not expensive, but it is a paid version. Most of them will have some sort of paid version, I believe.
Right.
Lois, you have it. What's the practice management software you use?
I use TheraManager through Psych Select, and they have secure email, they have online scheduling and electronic medical billing and electronic medical records. And so everything is on the cloud, and they have the BAA, and they're great because they're designed for therapists. So it's quick, easy to use. It's not real expensive. But there's another one too. It's called Counsel, COUNSOL, I think it is. And they actually have chat as well, but they don't have electronic medical billing. So I chose to go with the one that does the billing for the clients.
Excellent. All right. Well, I'd like to thank everyone for joining us today. I really appreciate it. We're going to go ahead and sign off now because we're up at the top of the hour. And like I said, if you have any questions, please don't hesitate to email us, and we appreciate your time. Any final thoughts or words, Lois?
No, thanks everybody for joining us. We had a great time. Hopefully it answered some of your questions.
All right. Thanks, everyone.
And don't let telemedicine scare you.
Exactly.
Bye, everybody.
Bye-bye.
See you, John.